wanted to thank you all much for joining us. We want to give you guys an update on where we are as it relates to COVID-19, the novel coronavirus. Wanted to answer any questions you may have, give you an update on the numbers, and reflect the news on the first death in the state of California related to COVID-19, which obviously marks a profound moment in our state and, more importantly, profound moment for the family members that lost a loved one. And our hearts go out to that individual. As you know, just recently, in the last few hours, it was confirmed in Placer County that individual passed away. Number of cases in the state of California is 53, and I want to just reinforce that. It's 53. I've read a lot, seen a lot, been a lot of media reports about the number of people that have tested positive in the state of California. That number as of today is 53. I'll remind you that includes 24 individuals that were repatriated in the state of California, 29 individuals that have subsequently been tested positive. As you know, we moved into the phase of repatriation going back early part of January, more formally at the end of January is the first phase of our engagement as it relates to the novel coronavirus. The second phase of that was monitoring people that had come through both San Francisco International Airport as well as LAX. That number at the time, you may recall, was 8,400. Now we estimate that number to be closer to 9,400 people that we are monitoring in over 49, in fact, directly 49 counties in the state of California. So first phase of our engagement on the coronavirus, repatriation. Second phase, the monitoring of people that came in on commercial flights through those two international airports, and those are currently being monitored, again, by 49 jurisdictions in the state of California. That number now totals 9,400. The third phase was last week or so, first community spread case in the state of California, here in Northern California. And as you know, community spread is no longer just in the northern part of the state. We've had a number of incidences throughout the state of California, no longer north, now in Southern California. We have accordingly, with this new ICU patient that passed away, entered into this next phase that has required me, under the circumstances, to advance a proclamation of a state of emergency in the state of California. This is not something that I say hyperbolically and shouldn't be reported as such. It would be incredibly misleading. The proclamation is to serve to help advance our resources, to loosen up our regulatory environment, to provide some clarity in terms of jurisdiction and oversight capacity as it relates to the access and utilization of state properties, be it fairgrounds or other state properties, and allow us to preempt local land use if indeed we feel that is appropriate. It allows us on the competitive bidding frame to move forward with our kind of procurement that's necessary with the sense of urgency on medical supplies or other monitoring or suppression efforts that would allow us to move forward without any hurdles. It allows us accordingly to share data in a way that is, I think, advantageous to addressing the spread and making sure that all of our jurisdictions, local, regional, state, and federal partners are sharing that same information. It allows us travel capacity both on the EMS, emergency medicine side, as well as more broad travel capacity, and it allows us to access out-of-state talent. Allows folks to come in with their licensing and credentials into the state of California and maintain those credentials and licensing status to help aid our efforts. So that's the framework of the proclamation of a state of emergency. That decision was made not just because of the individual that tragically passed away today, but because of another circumstance that has developed that I wanted to update you on as well. The individual that passed away in Placer County, as you may have heard a few hours ago, was on a cruise. That individual went to a cruise or went from San Francisco down to Mexico and back in February 10th to February 21st. That individual came back with a number of others into not only the Placer County area, but many other folks were on that cruise from the state of California. By one estimate, over 50% of the passengers, which total roughly 2,500 passengers, that does not include the crew, are Californians. We are working very closely with CDC and working closely with our healthcare partners up and down the state of California to contact all of the individuals from the manifest. We are in possession of the manifest of those passengers from that cruise, and working with our local partners, they will be contacting people in their jurisdictions in every part of the state of California. Those that are not California residents, the CDC is advancing protocols to do the same for folks that reside in other parts of this country, and we are assessing how many people were on that cruise from other parts of the globe as well. What is important for you to know is the following. That cruise that ended on the 21st, that same ship set sail a few days later to Hawaii. That cruise ship is making its way back towards the state of California, specifically back to the city and county of San Francisco. It was due to arrive this evening. That ship, we've requested to be delayed, the arrival to be delayed, and the ship is currently off the coast, and currently that ship is now being delayed to provide ample opportunity for the CDC, partnership with Coast Guard and with state health officials to conduct tests, because we have a number of passengers and crew members that have developed symptoms on this cruise ship. It's a Grand Princess cruise ship. As a consequence, we are going to be flying testing kits to the cruise ship, and we are going to be sending those quickly back to the state, and primarily to Richmond lab, where we'll be able to test very quickly, within just a few hours, those samples to determine whether or not these individuals that are symptomatic just have traditional cold or flu, or may have contracted the COVID-19 virus. We also will expand the testing protocols to even more passengers, as there are a number of passengers that held over from the Mexico trip and made their way on to the second cruise into Hawaii. So we're availing the testing protocols not just to those that are symptomatic, but also to address some of the anxieties of those previous passengers that are holdovers on the second cruise. So we're holding that ship, which is thousands of passengers as well, off the coast, and we'll be conducting those tests. We're getting those test results back. We are working very collaboratively with the federal government and the CDC on the manifest of those passengers that disembarked in the state of California, particularly, as I said, those residents. And that sort of led ultimately to the conclusion that a proclamation of a state of emergency would be appropriate under the circumstances. This proclamation, I want to point out, is not about money. It's about resourcefulness. It's about our ability to just add tools to the toolkit. We are well resourced in the state of California. I cannot say that enough. Oftentimes when you do a declaration of emergency, particularly on wildfires, it's to draw down federal resources. We already are the beneficiary of an announcement that we received today of $37 million of emergency grants that are forthcoming in the state of California. This part of the $8.3 billion appropriation that was approved by Congress today. And as you know, I've mentioned on multiple occasions, the state always anticipating the need to set aside emergency dollars, had $20 million set aside in our emergency fund. We're working with the legislature to get clarity on the ability to utilize those dollars, but we're early in the fiscal year, and as a consequence of being early in the fiscal year, people have ample budgets in this space. So again, money is not the issue for the state of California, but we are very blessed by the federal response and the good work of Speaker Pelosi and our congressional delegation to allow California to be well-positioned and well-resourced at all levels of government, not just the state, but substantively local level, to address this challenge head-on.